we're jumping straight into the health check with Dr. Bhagat. Today's topic is flu. Good morning, Dr. B.
Hey, you sound like you've never had flu.
Yes, I recovered the 2 weeks. Hey, I was down. Yeah.
The trouble with flu, Zoo, is well, we're in winter, so it's a relevant topic. But the trouble with flu is it often looks and sounds worse than it is. And when you're in the early phase of flu, you just think, the world's about to end. And it's intense, it's severe, it's body aches, it's just feeling like you can't get out of bed, everything aches. Then you get a nasal congestion.
You're hot, you're cold.
Exactly. So I don't need to tell anybody what flu is. But the purpose of today's chat is to, first of all, say that there is a big difference between the common cold, which is what you had, and influenza. People mix up the two.
Okay.
Influenza is a nasty, severe infection that can result in pneumonia and sometimes has been and can cause death. It causes bad infection of both the lungs and is caused by a virus, and it's something that we annually vaccinate against. I know people don't want to hear the word vaccinate, but we vaccinate against it and have been doing so for decades. The flu virus, pretty much like the COVID virus, changes every year.
Yes.
And so we have to update the vaccine. And when you get a flu vaccine, it protects you against this influenza, but it does not protect you against the common cold. And people have this misconception to say, Naka, I took the flu vaccine, but I still got a cold. And this common cold is something actually related to the coronavirus. It's a softer cousin of the coronavirus, which is what you probably had. It's a different variation of corona, and it's usually short. It's maximum 3 to 4 days, and the first one, day one, is where you were pretty hard hit. And you're feeling fine, but you get progressively worse as the hours pass, and then day 2 and 3, it's probably the worst, where you need to get some rest and plenty of fluids. And on day 4 or 5, you should be starting to feel better. And this is generally, everybody knows what it's like. And the purpose of today is to make sure that we distinguish between the common cold, which is what most people get, and flu or pneumonia, influenza, which is, you get a high fever, more than, 39, 40 degrees. You cough up greenish, yellowish, or bloody mucus. You get the chills that make you shake. You can't, you feel like you can't catch your breath. You're very tired. You start getting chest pains. That's a sign that something's going on in the chest rather than your upper, your nose gets congested and you have this runny nose, which is probably what you had. Now, the most important take-home message today, Zoo, is that people have this tendency still today, in spite of education, to run to their pharmacy or to their doctor to get antibiotics. And I really need to emphasize that antibiotics are for bacterial infections. The common cold is a viral infection. And so it's pretty much like you can't use antibiotics for COVID. You can't use antibiotics for the common cold. And please stop using these antibiotics, because we're getting huge amounts of resistance in our community because people are abusing and using and abusing antibiotics, which they think may help. And the GP sometimes feels pressurized to do it. Particularly if you've got a child with flu, you think, the mother will just keep harassing me unless I give an antibiotic. But the public need to be aware that there is no evidence that an antibiotic will work. What does work? Well, the most important thing is that works is actually rest, sleep, and probably what you did do. You chill out, you take time out. Absolutely. Shakespeare said, time is nature's nurse. So you just got to give it time. We live in such a pressurized world where we want to get back to the next day, and you can't, because it has to take its course. It has to actually get through your system. So get to bed, drink lots of water, because you're actually leaking lots of mucus either through a nasal drip or you may have a bit of a running stomach. And if your temperature is high and you're not feeling well, you've got a sore throat, take a little bit of paracetamol or Panado. That's all you need. People have tried all sorts of things, and most of them don't work. I mean, we've already started getting questions in about, vitamin C and oranges and lemons. And let's just deal with that one. Is orange juice good for you? Well, yes, if you take it before. In other words, prevention is better than cure. So if you've been taking vitamin C or oranges or lemon on a daily basis, there is evidence that it actually can boost your immune system and help prevent you get flu. Once you've got flu, pretty much the virus is in your system and nothing else will help except hot warm water, stay and take a little bit of paracetamol. Somebody's asked you, can flu turn into pneumonia? Influenza is a common cause of pneumonia, and like I said, this is not the common cold, and it especially occurs in younger children, pregnant women, and others with chronic conditions. So if you have these chronic diseases, get yourself the vaccine. They are effective. And somebody's asked you, what are the symptoms of flu? Well, we've talked about them, and if you're asking that question, it's very strange because everybody's had flus.
Yes.
Fever, it's cough, it's sore throat, it's a runny, stuffy nose, it's muscle aches, it's headaches, it's fatigue. Some people get a little bit of vomiting and diarrhea because you're swallowing all this mucus. Somebody's asked here, interesting question, how do you know it's COVID and not a cold? Remember COVID sometimes causes a running stomach. COVID sometimes causes nausea and vomiting. The common cold never causes diarrhea unless you're streaming with mucus, and it never causes nausea and vomiting. And of course, COVID causes, in the early signs, a loss of taste and smell. People have forgotten that, whereas the common cold hardly does it unless your nose is so stuffy you can't smell anything. So somebody's asked, can you be around someone with flu? Flu is very contagious. It's more contagious than the COVID, and an infected person becomes contagious and capable of spreading viruses to other people. So the same principles of the COVID, stay-at-home stuff and cough into your elbow applies to the flu and the common cold, because it's possible to spread flu germs for up to 7 days after becoming ill. So it's really important. Somebody's asked here, is it good to stay warm when sick? Staying warm when you have sniffles seems logical, but scientists have actually discovered that a warmer temperature actually helps. Colder temperature helps fight common cold more quickly. So actually sleeping in a slightly colder room, ironically, is actually better. Somebody asked, when do we have to take pills for this? Well, there are prescription antiviral medications, but the doctor, the specialist, the physician, or the GP will decide whether you really need, and we have them in the country, antiviral flu remedies, but we don't want to do that. Somebody's asked about herbal remedies. Well, you can take zinc, you can rinse your mouth with salt water, you can take some herbal teas like chamomile, peppermint, green tea. They're very good for you, a lot of antioxidants. You can apply some essential oils to your nose and to inhale, such as lavender. Exactly, you've done them before. And sometimes, when it's cold winter, people tend to put a heater on, and that dries the air, and it actually makes your airway passages very dry and much more prone to cracking and getting infection. So use a humidifier. Put in a little bit of water under the heater if you're having a heater, so that the air is not so dry. And I've got lots of questions. Do you have any?
Honestly, it is what you were just stating, because I just saw staying at home, really isolating yourself. Who is most at risk? I think that's the one question I'd like to ask.
The most at risk are small children, because their passages are not fully formed; they're still growing, and so the distance between the nose and the mouth and the throat is very small, so they can actually get infections very quickly, and they haven't learned to breathe well, so they actually look really terrible when they get flu. Their nose is running, they can't breathe, they're feeling lousy, and everybody's miserable. So small children, and of course those that are within the older bracket, those over the age of 70, who have by and large by that time many other chronic conditions. They're on medication for blood pressure, maybe diabetic, they may be on cancer treatment. And of course, those that are taking cancer medicines also. If you've had COVID before and you've had damage to your lungs, you of course are as much at risk as the others as well. Somebody's asked, what is the best sleeping position? Well, sleeping on your side often has several benefits. It promotes spinal alignment, and also it is the best position for drainage. If you remember, during the acute COVID, we actually got people to lie on their tummies, because it actually improved the way the oxygen levels did. So you can do the same thing as well. Somebody's asked, is paracetamol really good for you? Paracetamol will not ease the symptoms of flu. All it does is it's a painkiller. So if you've got muscle aches and pains, take it. But otherwise, don't take it because you think you're going to get better as a result of this. Another one here that's been asked here is what foods prevent flu? Yes. Well, ginger tea, when it comes to the common cold, ginger is one of the best foods for relief. Oranges, lots and lots of water, Greek yogurt because of the probiotics, blueberries, ginseng tea, tomatoes, antiviral. So these are really good stuff. Does sweat mean a fever is breaking? Fever is an important component of the body's natural healing process. When you have a fever, your body's trying to cool down by sweating. So, yes, indeed, when you're sweating, it generally indicates that the body's slowly recovering. Somebody's asking, what fever is too high for me to stay at home? I've got flu at the moment, and I am running a temperature. Well, the cutoff point is actually between 38 and 39 degrees. If you're more than that, then you need to go to hospital, because then the system is actually not. it's not coping exactly. Somebody's asked here, how long can flu last? Generally, it's up to 5 days. You know, if you're really having a poor immune system, maybe up to 7 days. But as you've discovered, and the way you sound bright-eyed and chirpy, you've already completely recovered.
Yes.
One more question here. Somebody's asked here, I don't know why it always comes up. Is banana good for flu?
Yeah, every time. This is not the first time I've heard this, Dr. Paget.
Bananas are a great food to eat when you're sick because they're soft and they're bland and they're rich in nutrients and fast-acting carbs. We actually use bananas to stop babies from having diarrhea because it contains a compound called pectin, so it slows down the gut. It's got lots of potassium in bananas, so it can replenish any electrolytes. So yes, I guess it's good for you, but can we move to another fruit at some point? I think it's the same guy asking the same question. Something about bananas. And I think, let me give you one more question here. It says, do showers help flu? Yes, steamy showers help moisturize your nasal passages and relax. If you're dizzy from the flu, run a steamy shower or do an inhaler, and it'll actually moisturize your airways. You can add a little bit of camphor or eucalyptus, and that really is good.
Awesome.
Somebody's asked you, can I wash my hair when I have flu? The answer is no. Colds are caused by virus, so you can't catch a cold from going outside with wet hair. So you can wash your hair if you want to.
I mean, there's a lot of different things. I actually didn't, it's more or less like steaming, so I didn't really put it into the showering. I just usually use a bucket, but I like that whole shower one. I'm going to use that, Dr. B. So, yeah, I think that's about it. But the one thing I want you to tell them is if the flu is not treated, what happens? Because I've seen a lot of people who just let the flu run its course. Like, nah, it's just a sore throat. Nah, it's just a blocked nose.
Yeah, so if you don't take, I mean, you know that the most important immune booster is sleep.
Yes.
We know that we've talked about this before, but when you sleep, your immune system actually jerks itself upright and starts working. So if you don't get enough rest, you don't sleep, you don't actually listen to your body will punish you. You know, it'll just be prolonged because you'll actually then keep reinfecting yourself. You know, if you're not gargling with salt water, if you're not taking lots of fluid, you get dehydrated. Your airways are dry, you're much more prone, because remember, this is a nasally transmitted, an airborne virus. So you're be infecting yourself. And of course, if you don't take care of yourself, you're actually infecting other people as well. So people in the family will catch it from you.
We'll just keep getting sick, yeah.
Yes. So this is the most important thing. And more than moisturizing and fluids and foods is to get some sleep and listen to your body. If it's telling you that it needs to rest, go and rest. Don't do work in bed, just go to sleep. It will really help you much better because, you know, this thing spreads through droplets in the air when people get flu and they cough and they sneeze and they talk from up to 6 feet away. So, you know, stay out of people's way and be mindful that other people that are also at risk of getting flu. And remember, talking about COVID, COVID is also a winter infection. So we are seeing rising numbers of infections. So, again, all those principles apply, you know, mask, wash your hands, distance,
sanitizers.
Sanitize. And if somebody is sneezing, try and stay away because we now know more than we did 2 years ago.
Yes. All right, Dr. B. Well, I'm so glad that you came and you let them know. Patung, today I've been really butchering English. I'm so I'm so glad that you're here and you're going to let us know. Next week, what are we talking about?
Next week, we're going to continue. We're going to talk about asthma. You know, we actually, unfortunately, still get deaths from asthma, which is a highly preventable condition, particularly in children. And I want to talk about it because it does get worse during winter.
Awesome.
So that's important. When you mix up and gobble up your words, in medicine we call it a word salad. So you just had a word salad.
And I have asthma too. Good, I'm going through a lot. See you next week, Sunday, Dr. B.